ask about medical marijuana. Does this have any movement in the House and Senate after what Governor Dayton said yesterday?
You know, we spent about 2 weeks working with law enforcement and advocates and others, trying to find a place of compromise, and including many of the things that have been talked about in the last couple of days. We are unable to get there, you know, so I'm not sure, you know, that's kind of the evidence that I have about the prognosis. If there's additional work that can be done, however, and more folks that want to engage in it, you know, that's a whole other issue, and, you know, good luck to everybody, but we've seen, you know, we've worked pretty hard to reach a compromise, and we haven't been able to get there yet.
If the compromise comes up after Friday's deadline, would you accept bring the bill up, or would you say it has to meet next Friday's deadline?
You know, it's a good question.
Thank you.
You know, this has not been the top priority in the session. We've said that from the very beginning, so you know, hopefully that we can, if we're going to get something done, we'll be able to move it quickly. It is an issue that's important to Minnesotans, and ultimately, if we're going to, you know, move past deadline, that's going to require buy-in from the legislature, from the Rules Committee, and from others to move it through the process another way. So I don't want to, you know, I never want to rule anything out, but if we're going to reach a compromise, we need to move on it.
You know, the governor's raised a couple of issues, and I do think it is useful to broaden the discussion. The discussion thus far has been a lot about law enforcement's objections, but there are health components related to this, obviously, as we learn from Minnesotans about the relief that they are looking for with medical marijuana. It's something I've supported in the past, but there isn't a lot of FDA-supported evidence. We have a lot of evidence from Minnesotans about their experience. So I do think it is fruitful and probably not possible to get this conversation done yet this session, but fruitful to have a broader discussion about the impact, the medical evidence, the medical and healthcare provider element of this discussion. And not a lot of that has happened yet this session. And there may be a more fruitful discussion that happens after session and into next year that could yield a better outcome on this issue for Minnesota.
You know, when I was in the House of Representatives, I voted for the bill as well. That was scaled down. I really want to say that the words that Majority Leader Murphy, I think, is important, that the conversation has been really scoped from a law enforcement perspective, which I think is very important, but that just is one side of the ledger here that says that people were going to abuse and do things that law enforcement would be concerned about, which I think is important. But I do think we need to look at it from a provider perspective of what it does and where the research is at and what ailments is it really effective from the, you know, the Charlotte's Web kind of piece for, you know, the baby. We've all seen, you guys have covered, for children with seizures to people who have MS and, you know, end stage or late stage cancer that allows them to live a better life. The last thing I'll say, because my wife and my father both would get after me because they work in chemical dependency, is we also need to invite that community in to have a conversation about this ideal of abuse or a gateway drug, or what are the kind of things that they see in the facilities that they work at, especially with young people, but others, about the combination around marijuana. And though I know it doesn't particularly affect the ideal of medical marijuana, but I think it's important for us to have a holistic and robust conversation about this, and not simply just the idea of the potential of abuse or somebody doing something wrong.
I think this is an issue that's has bipartisan support and bipartisan opposition. I think last week we kind of learned that it wasn't going to go anywhere, and now yesterday the governor made some statements that mean that maybe they're back at the table discussing it. I personally haven't been real keen on it. I think there's some issues that would need to be worked out in the current bill. I don't think that I would support, but we'll see how it works through the process. We certainly do have strong advocates in my caucus, and I do have people that have strong concerns about it as well. So we're interested to watch how it works through the process.
Well, and I heard something, and I I hope I'm not misquoting, but I heard that the governor is essentially saying we have a distribution system and it's working, so maybe we should just let things go. But this bill was before the Senate a couple of years ago. That bill, I think it's different than the one that's currently being talked about. I did not support that bill, and I think that and I'm not a doctor. I'm not a scientist. I think that's very likely that there could be a medical benefit to marijuana. The real questions come down to, and they've talked a little bit about law enforcement concerns, but there are other concerns, is the best way to decide what is an appropriate medicine to take it to a legislative committee where nobody has any real expertise, knowledge, or experience to decide that and rely on anecdotal evidence, or do you let something like the FDA, which we rely on for every other medication? We have opioids, for example, that are naturally grown, but we don't let people grow them in their backyard and decide how much they're going to take to take care of their problems. I think that on this issue, we have to decide what is the process that we're going to use. If we don't think the FDA is right, okay, where does that put us? If we think this should be done just statewide by state, I have real concerns for that process and the kinds of positions it puts pharmacists and medical professionals in, as well as public health issues. And so there are issues around this bill that haven't been adequately addressed, and that's why I opposed it before. I think that's possible that those issues could get addressed, and if they were, then it would be a different story. But so far, I don't think we've seen that bill.